Hi, thank you for your question. So for anyone who's new, this is in regards to the fact that I'm a trans man, and over the years I have looked like several different people, both male and female, just back and forth a lot. I've looked the same now though for like over 7 years. I know since I've been all over the place, some people find my story intriguing. However, it is not really unique. It isn't incredibly uncommon for trans people to detransition throughout some point in their life. However, it is very uncommon for a trans person to detransition just because they regret it. For example, back when I was a teenager, a big reason why I struggled so much with my identity was because of religious reasons. I was raised Irish Catholic and I really struggled with that. Even though deep down I knew that it wasn't right, that like being gay or being trans like equated to a perversion or something, when a religion has molded you so much throughout life, it's really hard to let go of, those thoughts. So that was the main reason back then, though there were other reasons as well. Then, as I always talk about, 3 years into my medical transition, when I was older, I was an adult at this point. I believe I was 28 years old when I had to stop testosterone. It started impacting my liver. That doesn't happen to everybody, but it did happen to me. And at that point, I detransitioned because I just didn't know what was going to happen. There was very little information on it. I didn't know if like all my changes were going to revert. I mean, at this point, I looked like this, so I was much more passing. I mean, I put a lot more effort into it back then. Now I just don't give a shit. I'd rather look hot and androgynous as opposed to like passing as a cis dude, but I look like somebody's counselor who eats a lot of salami. That's where I am now, you know. That didn't last long, only a month and a half, and I retransitioned. I have been like this for, like I said, 7 years. I consider myself male. Not everybody does. That's fine. Even if I had a beard down to my belly button, there would still be people that would never consider me male, so why care? So in my case, I never chose to go back on testosterone, and likely I never will. So for me, it didn't really like impact my health at all to like present as male, be on testosterone, then detransition, then retransition, because I never went back on hormones. I know this is ridiculous, but I gotta say this. I'm not a doctor, but I would imagine this depends on like a case-to-case basis. For people like me who have had like adverse effects of hormone replacement therapy, cycling it, like going on and off, wouldn't be the best. They actually did try that with me, and it just did not work for me at all. My levels would be like up, down, up, down. It wasn't good. So I guess it really just depends on the person and like what they choose to do during their transition and detransition. For me, the only other gender affirming care besides testosterone I had is top surgery. I had top surgery almost a decade ago, and never in the past 10 years, even when I did detransition, did I ever consider like any reconstructive surgery or anything like that. Even when I detransitioned, I was so glad I got top surgery. But also, I didn't detransition because I wanted to, you know what I mean? Like, there was a part of me that always knew, like, I'm probably not going to stay here forever. And I was honest with people about that. A lot of people ask if my liver went back to normal. Thankfully, it did. And it was so fast. Like, the liver is amazing at times. Like, at one point, my levels were so high. I was in the hospital, like, for something unrelated. And they did blood tests, and my levels were so high that they thought I had hepatitis. I tested negative. It wasn't hepatitis, but they didn't know what to make of it. Then, obviously, like, my hormone provider knew that this could be a side effect of the testosterone. And I'm not kidding you. Like, I don't know the exact, like, time range, but I'm pretty sure within, like, a month, my levels were, like, normal. I have had some like issues with like fatty liver ever since then, but nothing serious. Like my levels are really good now. I've lost weight. My scans are all good. I will say one thing though. Even though it didn't impact my physical health, it did impact my mental health. But a lot of times when a trans person talks about like transitioning and detransitioning and how it affects their mental health, other people will be like, duh, you think, you know what I mean? Because their mind immediately goes to the fact like, being trans equates to having a mental illness. Like we must be mentally ill. Which it was very hard mentally to detransition because I am trans and it was hard to present feminine again. That was really rough, like psychologically. But the hardest part of going back and forth in my 36 years of living would be like society and reactions of other people. I would say I'm pretty resilient, just the fact that like I went out like dressed feminine with king tattooed on my neck. But people got opinions. They don't shut up about them. And that's all good when it's like online, whatever, who cares? But when it's like in your community, like that's when it's a little uncomfortable, navigating those situations could be a little weird. And like, I understand people have questions, they're confused, because my story isn't cookie cutter and, it's natural to be curious. But when you're already going through a rough time to have to navigate like everybody's like, questions and curiosities and doing stuff like that during those times, then it was really rough. I found that kind of hard. But I've done it before multiple times, and if I ever need to do it again, I will do it again as well.